wine, baby.
What's up mga kaPTids? My name is Kyle.
And Leandro. For today, our objective is for you to know and to understand the moina of the elbow complex easier.
Before we start this episode, a little disclaimer. All the images and information that you will be seeing today are derived from the books of Snell, Tortara, and Netter.
Let's go!
For the first part of this discussion, I'm going to show you the three bones articulating your elbow complex. In that way, it will be easier for you to locate the origin of the muscles in your elbow and in your forearm. So your elbow complex is formed by your three articulating bones, your humerus in the upper arm and the ulna and radius in your forearm. Your humerus is the longest bone in the upper extremity. Muscles attached to this bone distally usually contribute to the movement of your elbow, forearm, and wrist. Next is the radius. So your radius bone is located at the forearm, especially in the lateral part in the anatomical position. This bone provides forearm pronation and supination and wrist motions articulating with your carpal bones. The last bone is the ulna. The ulna is the other bone forming your forearm. It is located at the medial part in the anatomical position. The same with radius, it provides forearm pronation and supination and wrist motions articulating with your carpal bones. Now that you've known the basic bones about your elbow complex, it's time to introduce to you the muscles of our elbow complex.
In this segment, we are going to discuss the different muscles of your elbow complex.
That's right, partner. To start off this discussion, let's begin with your elbow flexors. So your elbow flexor is composed of four muscles: your biceps brachii, brachioradialis, brachialis, and your pronator teres. Except for the biceps brachii, these elbow flexors originated mainly at the humerus. Let's start with the brachialis attachment. So the attachment of the brachialis starts off with the lower half, anterior shaft of the humerus, and ends in the coronoid process of the ulna. Brachialis is known as the prime mover of or flexor of the elbow joint.
The attachment of your brachioradialis begins in the proximal lateral supracondylar ridge of the humerus and ends at styloid process of the radius. This muscle is the most superficial muscle on the radial side. It also provides assistance to forearm pronation.
Next muscle of your elbow flexor is your pronator teres. This muscle has two origins, one at the medial epicondyle of the humerus for the humeral head, and the other is a medial coronoid process of ulna for the ulnar head. Although its primary function is to pronate your forearm, this muscle is a great assistance for the flexion of your elbow complex.
Lastly, for the elbow flexor is your biceps brachii. The biceps brachii also has two origins. One is at the supraglenoid tubercle of scapula, which is the long head, and the other one is at the coracoid process of scapula, which is the short head. This muscle is the prime mover of your forearm supination. It also gives assistance for shoulder flexion.
Now let's talk about your extensors. There are two muscles that are both extension, which are your triceps brachii for the elbow extension and your anconeus for the forearm extension. The triceps brachii has three heads with different origins. The long head starts off in the infraglenoid tubercle of your scapula. The lateral head starts at the upper half posterior shaft of the humerus, and the medial head starts at the lower half posterior shaft of the humerus. This muscle helps in the extension of your elbow joint and also acts as antagonist for brachialis and your biceps brachii.
Lastly, your anconeus is attached to the lateral epicondyle of the humerus and ends at the olecranon and superior shaft of the ulna. It is described as a small, triangular muscle and its task is to extend your forearm.
So your forearm has two movements. It is pronation and supination. To do so, you need five muscles to use in the action. So you have your pronator teres, pronator quadratus, and your brachioradialis for the pronation of your forearm, while for the supination is your supinator and your biceps brachii.
Since three muscles were already mentioned earlier, we'll give focus to the other two muscles. First is the pronator quadratus. Your pronator quadratus is located at your wrist. To be exact, it originates at your distal anterior of the radius and is inserted at the distal anterior of the ulna. Its function is based on its name, which is to pronate your forearm. This muscle is your prime mover for pronation and stabilizer of your radioulnar joint.
And for the other muscle for your supination is your supinator. The supinator origins at the lateral epicondyle of your humerus and ends at the superior crest for the teeth muscle part. As the name suggests, its primary function is to supinate your forearm. It works with your biceps brachii when it comes to a powerful supination. It's time for fun fact.
Yeah, yeah.
In the anterior of your elbow lies your cubital fossa. Your cubital fossa is a space filled with different structures that makes up its contents. It has the three boundaries or borders and the floor and the roof. The borders of your cubital fossa are the following. Your apex is your imaginary line connecting the medial epicondyle and the lateral epicondyles. Your medial border is the pronator teres muscle, while your lateral border is the brachioradialis muscle. The floor is formed by your brachialis and the supinator muscle, while the roof is formed by the skin and the fascia of the arm and forearm, reinforced by the bicipital aponeurosis.
Another fun fact is that there are muscles located at your forearm that is not a mover of your elbow and forearm, but rather it is for your wrist. These are your wrist flexors and wrist extensors. Despite having the same origin with your elbow complex muscles, these muscles such as your flexor carpi ulnaris, flexor carpi radialis, extensor carpi radialis brevis, and extensor carpi radialis longus function at your wrist. More info about your wrist complex will be further discussed in the next episode. Now, we're going to talk about the nerve innervations of the elbow complex. Overall, there are three nerves that innervates in the muscles of the elbow complex, namely the musculocutaneous nerve, the median nerve, and your radial nerve.
The musculocutaneous nerve innervates your elbow flexors such as your biceps brachii and your brachialis, while the median nerve innervates your forearm pronators, and the radial nerve innervates your extensors, the lateral part of the brachialis, and your supinator. Now that you have known the moina of the elbow complex, shall we go to the next part? Let's go!
Here we are at the last part of this episode. We are going to share some tips and ideas on how are you going to study moina of the elbow complex. So, Kuya Kyle, as a senior student, what tips can you share to our freshies that may help them in their studies?
Ideas or tips for studying? Uh, Actually, I've been using three strategies when I was in my first year. So, one is creating mnemonics. So, I've just get the initials of the letters or the first letter of the word. For example, is my own mnemonics for the elbow flexors 3B1P. So, meaning you have three muscles named letter B, while 1P meaning you have one muscle that started with the letter P. So those were your brachialis, brachioradialis, biceps brachii for the PB, and your pronator teres for the 1P. So next tip or strategy is organizing them. Like you compile or list down the muscles based on their origins, insertion, action, or nerve supply or innervation. So it is actually easier and a good way to study minor because there will be questions asking you the origins of this muscle, like the insertion of this muscle, like the commonality of this muscle, like their common nerve supply. Some that kind of questions will appear on your quizzes or in your major exams. And last, a strategy or tip is that labeling or illustration. So normally, students draw their illustrations on the notebook, on their notes, in their pad. But when it comes to me, I use my own body parts, and that's where I draw everything. Like that I needed to learn. I also do labeling, such as like for the dermatomes, or like this is the origin of this muscle. Like I drew lines, meaning I'm trailing the insertion of that muscle. So those are my tips in studying. I hope you can use them, guys.
For me personally, I find the Pomodoro Technique the best study habit for me, for myself. So if you guys want to try the Pomodoro Technique, it is when you study for a period of time and then you take breaks. So for example, I'm going to study for 50 minutes and then I'm going to take a 10-minute break or a 5-minute break, and then I'm going to study again for 50 minutes and then 5-minute break and then 50 minutes, and then as I progress towards my studying, I increase the time that I'm going to allot for studying. So for example, I studied for 3 consecutive 50 minutes. I'm now going to study for at least 1 hour. So that is my way of studying. So with that, I'm going to apply that, or I'm going, since I'm a freshman and Moina is slightly introduced to us when I was during our first semester, but it was not an in-depth discussion. So I'm going to try that technique when studying Moina, since I that is the best studying technique that I have applied in my life. So I don't know if everyone else will find that technique useful for yourself, but go try it, and if it works for you, then continue using it. Those tips and ideas that me and Kuya Kyle have shared are not only limited for studying Moina, but can also apply it for studying in other subjects that you are currently taking.
And that's it for today's episode.
It looks like it's time to say goodbye. But don't worry guys, you will meet us again.
We prepared a lot for the upcoming videos, so you better stay tuned next week. We would like to thank the Movement Expertise Societies for giving us chance to share our knowledge for the students, especially to the first years or freshmen.
We would also like to give thanks to our partners for this series. Without their help, this series won't be a success.
If you have questions or comments, just leave it down below this video, or you can message us through our Facebook page, Movement Expertise Society.
I hope you guys learned a lot in this episode.
Make sure to tune in for more minor lessons.
Wishing you all a good luck in your studies.
Always stay safe, and see you on the next video. Bye-bye!
Yeah, it's Moana, baby.